Hello, this is Dr. Jason Munsell. It is about 11:40 Tuesday, July 18th. I am here in Folly Beach, South Carolina. Some folks are getting together, got a beach house, so invited along. So I'm sort of on vacation, but not really, because I'm going to go through some of chapter 3. If you have been reading my emails and everything like that and staying in touch, you know that this morning I got through some more threads and the most recent threads and tweets, and I'm slowly getting through the first big assignment of the Obama Trump stuff, but I'm really liking what I've been reading. And just as a reminder, I'll have another thread up, another topic up tomorrow, and continue to tweet and all that type of stuff. But this Sunday is when the second big assignment is due. And again, I explained it in the last online lecture, but it's just sort of a list of effective communication skills you think patients should have and providers should have, utilizing the information from chapters 3, 4, and 5. Yesterday I talked about chapter 3. Today I'm going to talk a little bit about chapter 4, not all of chapter 4, but we'll see. And that is all about the patient's perspective. That's a patient. Okay. Patient perspective. Yeah, it talks about, well, they always start with stories, but the smell of the doctor's office. I like the way doctor's offices smell. Actually, I put rubbing alcohol and stuff like that all over my home. Just so smells like a doctor's office. The smell of medicine. The smell of antibacterial soap. I love the smell of antibacterial soap in the morning. It smells like victory. Okay, so lots of stuff going on in this particular chapter. But generally speaking, we have this very weird context of nonverbal communication. I say, you're sticking what up my butt? But obviously it's a very sort of disclosive situation, but we learn that we need to disclose and disrobe and all that type of stuff for our doctor, because it's a professional setting. And it's really interesting, the whole body as a landscape. It says, Christian Heath said patients typically lower their eyelids, turn their heads aside, and gaze into the middle distance during potential embarrassing or painful examinations. Yeah. Okay, but we have this idea of body work. And there's some gender stuff that's going on that they didn't really talk about. As you probably know, most doctors are male. That's changing, but so it might be uncomfortable for women, but also, I mean, I remember when I had a probably TMI here, but prostate exam, because that's what you do, and it was a intern or something like that, and she was a fairly young woman, and I felt sort of weird, because that's but it's also, I shouldn't, because But in any case, okay, so through our communication, through our verbal and nonverbal communication, we sort of perform patient and doctor. And so it's pretty interesting stuff. So verbal interactions, and basically one of the... That's my wife's phone. Maybe she's calling me. I'll let it ring. Long story short, the doctor calling. Oh, maybe it's Obama. Maybe it's Trump. Okay. Yeah. But in one study, 1 in 7 patients said they tell their doctors outright when they disagree with them. But most fear speaking up if they do disagree with a doctor. So again, through our verbal interaction, we sort of perform patient and doctors perform stuff. And all this is socialization. We learn our roles. This is how a patient should perform. This is how a doctor should perform. And as we learned from the last chapter, oftentimes those relationships are asymmetrical, which is problematic. So this chapter, again, is all about just the patient perspective and all the different stuff about the patient. Have you ever seen a movie called The Meat Puppet? he has a taste for beautiful women. The Meat Puppet. By Joe Valenti film. That's horrible. And the only reason why I did this is when they move into the voice of the life world, it has this image of actor Jessica Tarr, and I had never heard of Jessica Tarr. And so I Googled her, and this was one of the movies that came out, or came up. She starred in The Meat Puppet. Oh, I'm sure that, I think it won an Academy Award. Was it her name in here? Starring, I don't even see her. Maybe it's, oh, there it is, Jessica Tarr. Okay. Okay, the voice of life world. It's sort of cheesy, but okay, it does sound like a movie. Starring Brad Pitt and Jessica Tarr. The voice of the life world. Okay, so we have the voice of the life world, and we also have the voice of medicine. So the voice of the life world is basically from a patient's perspective when we're talking about, health and illness and stuff like that. We are thinking about and talking about our entire lives. The life world, primarily concerned with health and illness as they relate to everyday experiences. Whereas health professionals oftentimes use the voice of medicine. It says health professionals may understand back pain in terms of specific discs and muscle